Let's talk about perimenopausal arthritis. What is it? What are the symptoms and how can we treat it? So perimenopausal phase is a phase where you are crossed your 40, 45 and you're approaching towards your menopause, and at this time you have lots of hormonal changes that's happening in your body, and also you are aging, because of which the cartilage loss is happening in your knee joint, and you're facing some kind of pain in the knee joint, stiffness, especially early in the morning, especially when you try to walk for a few initial steps, and slowly as the day passes your pain may decrease. Now what is the reason for this perimenopausal arthritis? Like I said, the two important reasons are cartilage loss and the second is the hormonal changes that are happening. Now why the hormonal changes can bring this aggravation of knee pain is because our estrogen, we know, is very important hormones, and it's very important to maintain internal environment of a joint in a favorable form. But when estrogen starts decreasing, the inflammation in the joint can also increase, which can lead to increase in the joint pain, and also other hormones like progesterone also plays an important role. So the disbalance between estrogen progesterone at this phase can lead to aggravation of your knee joint pain. So now what we are supposed to do? First thing is, once your pain has started, do not ignore it. So you need to visit your doctor. Go get yourself evaluated. The doctor should first see and talk to you about what are your symptoms, how much problem you are facing with your symptom. Is your daily activities getting affected? What are the activities that are getting affected with your knee joint pain? Then certain tests, there are certain physical tests to identify how much is the range of motion, what is your muscle strength like, what type of walking style is changed. So after noting all those things, we have certain tests like X-ray or ultrasound scan. Ultrasound scan being the best because it can be done very easily, and if there is any fluid collection, what is the amount of cartilage loss, where is the cartilage loss, is there any ligament problem that's happening, how are your muscles, is there any Baker cyst, is there any bursa present, so the physician can tell you properly what's about your knee joint seeing in the ultrasound scan, and accordingly you can opt for treatment. So based on the cartilage loss, there are certain exercises, certain supplements like keeping your bones strengthened with good calcium and vitamin D, some collagen tablets. But if your pain has now started to affect the daily activities, for example, if you do cooking is difficult, if you go out to work and walking for a short distance is becoming difficult, sitting for a long time is becoming difficult, if your night sleep is disturbed because of this pain, then you need to opt for certain treatment. And what are the treatment? There are lots of non-surgical treatment which is available, and it's not always the surgery that you need to go through. So most of the injection techniques which your doctor should prescribe you depending upon your condition, and you can opt for these injections. The most important and best way is a cell therapy, cell-based therapies, which are giving very good results. So you don't need to suffer with perimenopausal arthritis. Talk to your gynecologist about it. If you are planning to undergo any kind of surgery with respect to removal of your uterus, do plan your knee pain treatment with your gynecologist and also your pain physician, so that post surgery, when you are recovering, you don't have to face with your knee joint pain. So take care of your knee joint, and every pain has a solution.